Hi guys, how are you? Yeah, I couldn't wait to get home and show you guys. I just want to show you guys, and really not for the non-believers, but for the people that have congratulated me on this big victory, on these great news, on this victory in Jesus Christ. Praise the Lord. I'm gonna show you guys right from my laptop the results of the CT scan. I have read some of the comments that you guys have written, and I see that for some people they're in disbelief. They're like, how did you go from stage 3, at surgery, to then stage 4? You were told stage 4 last week, and then all of a sudden your scans are clear. I mean, it's not all of a sudden. I've been doing a lot every day, doing a lot of different things, and focused on my nutrition, my exercise, and a new lifestyle habits and changes. So it's not all of a sudden, but for those of you that would like to think it's all of a sudden, then go ahead. But yeah, without further ado, I'm logged into my MyChart account. And yeah, my name is on the corner. I'm going to show you that. I'm going to show you guys that. So it's my account. And I'm going to show you guys the CT chest, abdomen, pelvis with contrast results. I'm going to read it off to you guys. Let me show you. This is it. And actually, let me just turn the camera. You guys will be able to see it better, because I'll see it better. Let me see. So there's my name, LaRuby. And here we have my latest test. CT chest, abdomen, pelvis with contrast, my doctor. And it was done last Friday, July 7th. So we're going to go ahead and open this up. All right, Mount Sinai. Here are the details. So it's a CT chest, again, abdomen and pelvis with IV contrast. Oh, it got blurry. There you go. Indication: ovarian cancer staging. Status: post left salpingo oophorectomy, amentectomy. Sorry guys, I'm butchering the words here. Pelvic and periodic lymph node dissection in December 2022. So for those of you that doubted surgery, that's clear. I had surgery in December 2022. Reported history of pelvic nodules in the right pelvis and central pelvis. An outside CT performed 4/29/2023. So there we have the history of the nodules. So as you guys can remember, there were 2 nodules that were found in the stomach lining, and they were found in that CT scan done at MSK. So yeah, they're aware of this. The person that's doing this CT scan. Let me turn it back on to the screen. The technique is there. The intravenous contrast. So they're comparing this CT scan that was done last week, July 7th, to my scan that was done on February 14, 2023. That particular scan of February 14, 2023 was done by Mount Sinai. And this was my first scan that was done after surgery. My surgery was in December 2022, but my first scan after surgery was done on February 14th, 2023. So what did they find, right? What did they find? Everything, the findings. Normal, cardiovascular, normal. No pericardial effusion. That's the heart over here. lymph nodes, and mediastinum, no thyroid lymphadenopathy, no metastanomas, airways, no central interpercranial lesion, pleural lungs, no pleural infusion or non-thorax, pneumothorax, no focal consolidation, no suspicious nodule, chest wall normal, liver normal, bile ducts normal, gallbladder normal, spleen normal, pancreas normal, adrenal glands normal, kidneys normal, bowel intersected under distended stomach, no bowel obstruction or inflammation, normal appendix, peritoneum trace pelvic fluid, physiologic, no free air, surgical clips in the mid and right pelvis, right lower quadranodule measuring 0.5, unchanged since November 28th. So I remember that the surgeon, when I went back recently, that he did a follow-up after like 6 months, he said that there was a nodule of 0.5, and I was like, what the heck is he talking about? What the heck is he talking about? It looks like he was talking about that nodule, 0.5 since November 28th, which is before the surgery, because the surgery was done in December. All right, so let's go back to the screen. Lymph nodes, no lymphadenopathy, normal. Sorry guys if I'm butchering the words here. Retroperitoneal vessels normal, caliber abdominal tora superior, pattern, urinary bladder normal, reproductive organ status post left salpingo oophorectomy normal, anteverted uterus no adnexal mass, abdominal wall, small fat containing umbilical hernia. This is the first time that in any CT scan I am told that there is a hernia. Interesting. Bones, no acute abnormality. Impression, drum roll please, and this is the moment that we've all been waiting for all these months with all this work. No evidence of recurrent or metastatic disease. Stable exam compared to 2/14/2023. And an attending physician note, I have personally reviewed the images and interpretation thereof and agree with the findings. So there you have it, guys. Those are the results of my latest CT scan. I mean, there's no way I could have made that up. Like, who makes these things up? I mean, you know, I don't think I had to go as deep in like going into the paperwork, but I promised you guys that I would. For the believers, for the non-believers, what would you say now? You still wouldn't be satisfied, would you? What now? I've already read it. I'm so happy, guys. I'm so happy. And for those of you that are happy and crying with me, I know, like, I get it. Like, you know, there's no way that we can feel in this situation, because it's just an incredible joy and an incredible rejoice in God and in God's miracles and what He has done for me in my life and my family and my kids, and the fact that I can be here for my daughters for a long, long time. So I need to continue what I'm doing and not get off track. These are incredible, incredible, incredible news. I'm going to do another video showing you guys my CT scan results of MSK. The MSK one was done 4/29. That's where they found the nodules. I'm gonna do another video on that. But right now, I think I'll show you guys the CT scan of February 14th, so you guys can see the language of the CT scan that was done on the 14th, because they compared it. They compared this one, the July 7th one, to the one on February 14th. So maybe that will help in seeing clearly what they saw, the comparison. You know, I thought originally that they were comparing it to the one at MSK, and they didn't. It was to my surprise. I thought they would call MSK and ask for those videos and do the comparison, but that's not what they did. To my surprise, they did it to the one on February 14th. My oncologist did ask in the last appointment that I get the CDs from MSK so they can see the results for the CT scan and the PET scan, and then they can do another comparison. But I'll show you guys now the one from February 14th. I think that will be helpful. So let me go back here.
I can't find it. Why?
Let me click on the 14th of February.
When you were gonna get it, I stopped you.
You guys ready? Let me show you guys that
What do
one.
you mean? In the morning? No.
And again, guys, the one I just read for you is the one from July 7th, the CT scan that I just had done this past Friday.
That's yours.
All right, let me show you guys. Let me show you guys this one.
That's yours.
All right.
No. So the last say sorry to me. Sorry.
All right, guys. So the clinical information: left ovarian dysgerminoma. The comparison for this one is a pelvic MRI that was done on December 5th. Or is it? Yeah, pelvic MRI December 5th. Interesting. So that's right before surgery, because my surgery was December. Oh, it's blurry. Sorry, guys. December 15th. And then CT abdomen pelvis, which was done on the 28th. And you guys remember that I just said that there's a nodule that's 0.5 from this date, and it has remained unchanged, and we're now in July, which the oncologist told me that if that would have been a cancerous nodule, it would have grown drastically by now. So the fact that it stayed the same size, that shows that it's not cancerous. All right, so let's go to the findings. Again, this is the CT scan results of February 14, 2023. All right, guys, here we go. All right, so the visualized thyroid normal, vessels normal, cardiac normal, heart size, no pericardial effusion, lymph nodes, no thoracic lymphadenectomy, airways. Sorry, guys, I'm butchering the words again. Airways, no central endobronchial lesion, lungs, no focal consolidation, no suspicious nodule, pleura, no pleural infusion, chest wall normal, liver normal, everything normal. If you guys can see over here. It gets blurry when I put my hand out. Normal, everything. Gallbladder, spleen, pancreas, adrenal glands, kidneys. Urinary bladder, normal. Reproductive system, normal uterus. Left oophorectomy, no adnexal mass. Bowel, no bowel obstruction. Appendix, normal. Peritoneum, trace pelvic fluid, physiologic, no free air. Normal. Superior mesenteric artery, patent. Retroperitoneum, no lymphadenectomy, right external iliac and left common iliac, surgical clips. So there's surgical clips in the reperitoneum, abdominal wall normal. Bones, no acute abnormality. AI doctor, artificial intelligence, concordant impression, no evidence of recurrence or metastatic disease. So this is the CT scan that I had done, that I requested actually. I requested from Dr. Berg at Mount Sinai after the surgery, because when I met with her, the oncologist, which was like 6 weeks after surgery, she said that I needed to start on chemo right away. Adjuvant chemo, I think it's called. She said I had to start chemo right away, but I said no, I would like to have blood work first, and they scanned to see what my body looks like after the surgery. What if there's nothing there? That's what I suggested. I said, what if nothing is there and I just go into chemo. Then why did I go into chemo? Well, they explained over and over again that there could be microscopic cells that we can't see. And I'm actually gonna do another video where I read to you guys the notes of the scan of the, not the scan, sorry, I just did that of these two. The notes of that visit with Dr. Berg, which was my first oncologist, where she explains that I needed to do the chemo ASAP. Yeah, but when they told me that there was no evidence of disease, I felt ecstatic, I felt ecstatic about that. And I thought, and God guided me into juicing and just changing my lifestyle completely. But yeah, guys, so those are the results. Again, the first one that I showed you was my latest CT scan that was done on July 7th. And then the last one is my CT scan, which was the comparison to the July 7th scan. The last one was February 14th in comparison to the one on February 14th. So I hope this helps in clarifying a lot of the information that has been shared here on my YouTube channel. And any questions you guys may have, please put it down in the comments down below. I love you guys very much. See you soon. Bye.